That way everybody benefits from it, okay? My name is Dr. Chris Bowman. I'm a chiropractor. That's what these initials are. These ones here says I'm a diplomat in chiropractic pediatrics and prenatal, which means that I did my undergrad, and then I did chiropractic school, and then I spent another 400 hours on the weekends while my wife was pregnant with a newborn, going to seminars learning about chiropractic for kids, chiropractic for pregnant ladies, and then also chiropractic for special needs. So I would consider myself an expert, in this area. My goal is to make you guys experts as well. That doesn't mean you're going to have as much knowledge as I have, obviously, but it means you're going to be able to apply it just the same. Okay, so that's my goal, is to give you as much information as you need to make educated decisions for your kids, and then hopefully give you some action steps to do on the end as well. Okay, I can tell it's going to be a good night. You guys are already laughing at my dumb jokes, so I think this is going to be really fun for me. So just a little bit about me. I feel like when I go to a speech, I like to know a little bit about the speaker. I'm married to my wife, Jess, and we have 2 kids, Rosie and Emmy. We just found out a couple weeks ago we're pregnant again, so we're going through that process again, which is exciting. I already mentioned pediatric and family chiropractor. This office does focus on, as you've seen kind of on the door and whatnot, on neurodevelopmental disorders. That's kind of what we're known for in this area. We see kids of all ages. We see kids of all symptoms. We see parents of all ages and all symptoms as well. I would say this is just where we really try to focus in, in our marketing, and really like the parents that I really love to connect with, okay? The major overarching theme that we're going to be talking about tonight is going to be revolving around this word right here, salutogenesis. Raise your hand if you ever heard that word before. Okay, so if we break it down, salute, any, yeah, health, right? Okay, and then genesis. Bible readers? No? Origin, right? So salutogenesis is the origin of health, right? Its counterpart is pathogenesis. Does that sound kind of familiar? Looking for the origin of disease, right? So salutogenesis is an approach focusing on factors that support human health and well-being rather than just on factors that cause disease, okay? The reason why I put this here, and the reason I call this our overarching theme, is because while we'll be talking about autism, we'll be talking about ADHD, we'll be talking about all the different labels that kids can have, our goal is to kind of leave that all in a clump and pull back the curtain and go behind the scenes. What is the common denominator that links them all? Okay, so no matter whether you have autism, ADHD, OCD, seizures, all the whole spectrum of things that you guys connected with, however you heard about this talk, don't think that I'm ignoring you. I'm saying that there's a common denominator between all of them. That is the most important thing to focus on, okay? So no matter what you have, whether it is a kid with neurodevelopmental disorders or one yourself, or cancer, or fusion, or whatever you're struggling with, the things that we're going to be talking about tonight are going to help you. Why? Because we're coming at it from a salutogenic perspective. We're bringing health and life and vitality to the body rather than trying to take away disease. Does that make sense? Great. And then what I always like to do as well is start off with just a few testimonials, and the reason why is these people came to workshops just like you, okay? So I like to make sure that you guys are able to connect with moms and dads just like you. Only one guy tonight. Thank you for coming. I appreciate it. This little kid had ADHD off the charts. He was like a Tasmanian devil that came into the office. And with just a little bit of chiropractic care, she was able to have him function, much better in school. And the really cool thing about that testimony is she is a special needs aide. And so she sees and knows how to work with these kids, and she recognized that her kid was one of those kids that she worked with and saw a significant difference. And then one of my favorites, this kid was diagnosed nonverbal autism, and by the end of our care, he was that nonverbal part came off. And he wasn't like full speech, but he went from severe to pretty much neurotypical classes, by the end as well. And so those are a few of my favorite, testimonials, just to show you, look, what we're going to be talking about tonight is not just some theory, that we're going to be unearthing the science. We're going to be digging deep into a whole bunch of different journals and books, and not just stuff by chiropractors. It's not just my clinical experience. This is MDs, PhDs, peer-reviewed, journals that we're going to be going through tonight. So I'm going to synthesize all this stuff, which all these papers and books would probably stack up to here, from here, and bring it down into about an hour tonight, okay? So I will take little mini pauses. We'll go deep into a topic, and then I'll pull back. We'll go deep into a topic, then I'll pull back. So it feels like your ears are bleeding, or leaking conversation, leaking information. Let's wait for that break. So overall, we're going to be having a simple outline. What is going on? Why is it happening? And then obviously the action steps. What's next? Okay. So the reason why we're going to have this talk tonight, the reason why we can get a good amount of people to show up regarding autism, ADHD, and the like, is because we have skyrocketing numbers where back in the 1970s, 1 in 10,000 were struggling, right? And I think it's even, I had 2018, 1 in 59. I think it's somewhere around like 1 in 54 or something like that now, right? And that's autism. ADHD is even higher. I'm sure anxiety is even higher coming out of 2020 and 2021. I'm sure depression is higher. I'm sure, OCD, I'm sure all these things are much higher now. And so I can't even believe what the statistics are going to be like. I'm going to have to update this slide probably in a year or so when that stuff, actually starts to come out. But the reason why we have to have this talk is because curves like this don't just happen by chance. They don't just, and we'll talk about this in a minute, they don't just happen by genetic changes. There's something in our environment, there's something in our bodies that our kids are reacting to, and that's really what we're going to dive into. When we look at on this slide here, 6.4 million or 11% of 4 to 17-year-olds have been diagnosed with ADHD as of 2011. 1 in 8 or 9 million have an anxiety disorder, and I would put money on that is much higher, now in our parents and our kids. 43% or 32 million kids have at least one of 20 chronic health conditions, okay? And so what this slide tells me is that we don't just have a neurodevelopmental issue, we overall have a health issue. Right? Is a chronic disease communicable? Meaning, can I give somebody a chronic disease? I can't, right? Because chronic disease is things like diabetes, it's things like allergies, asthma, those sort of things, right? Most of the time, chronic diseases come from lifestyle choices, or come from a lifestyle being adulterated in a way that's not, compatible with life, and so the body is reacting to that incompatibility, and we'll talk about that in a minute, okay? And so this is the major concept that I want you guys to understand as well, is we don't just have an autism, ADHD, ADD issue, we have an overall health issue, and I'll tie all those dots together at the end. So what we're gonna do is we're gonna start with the basics, okay? Which means that if we're gonna talk about what optimal health is, if we're gonna bring life and health into the body, we kind of want to understand like how the body works in the first place, right? So we'll break it down, not even talking about living systems, we'll talk about this mechanical system. What does this car need to work? And you can just shout it out. You don't have to raise your hand. An engine, right? Gas, yep. So you need parts, you need power. So let's say you have a fully gassed up, fully put together, Audi or just not a Tesla. Is it going to go anywhere? It's not, right? A Tesla will go. That's why I have to change this slide in a couple years too, because all of the cars will do that at that point, right? And so, will this car go anywhere? You got all the parts, you got all the power. What are you missing? So the driver gives the car information. Okay. If you move it to a computer, pretty straightforward. You got all the programming, you got all the power, but it won't do anything unless you tell it to, right? So a computer also needs parts, power, and information. So now that we have that thing going in our mind, what do you think living systems need to work properly? Probably pretty similar stuff, right? So our parts, our body parts, heart, lungs, digestive system, fuel, good air, good water, good food, right? Let's say we have all of that. What's the difference, or where does the information part come from? What do you guys think? Ish? What's interpreting the environment? Yeah, our nervous system, right? So you can kind of see it here. It kind of looks like the blood system, so I'll give you a pass. But you got the brain right up in here and the nervous system. So the nervous system is our master communication system and sensory processing system. Okay, we'll get into it deep in a minute, but I'm still trying to lay the basics down. So if we look at an overall living system, systems are made of parts, which means they can eventually break down, okay? So let's take, this plant, for example. What happened, if you had nice green sprouts growing and the temperatures went down to like 30 degrees, right? What happens to the plant? It dies, right? Because that temperature is incompatible for that life. Or let's say it needs full sun and you don't give it any sun. It's not going to live, right? Let's say you give it chlorinated water. It's not going to do so well, right? So what happens if you take away or stress the parts, power, information of a plant? It's going to show symptoms, right? So if you take the same concept and put it into humans, you got our fluorinated water or, city water. You got our sad diet, right? You got your burgers, fries, gummies, all of that stuff, especially for our kids. And especially now, all of us being inside so much, no vitamin D, no introduction to bacteria and all those other things. Symptoms are a perfect expression of our parts, power, and information. Okay? So this is the big light bulb moment that I need you guys to have. Because normally when you have a symptom and you call your medical doctor, what is the goal? To make the symptom go away, right? But is that actually addressing the root cause of the issue? No, right? Because if you're gaining weight because this is your diet and you get liposuction or bypass surgery, is your weight going to go down? I mean, maybe a little bit, right? But that doesn't fix the root issue. Maybe your weight goes down, but then you get diabetes. Or your weight goes down and then you get high cholesterol. Or your weight goes down and then, you know what I mean? So the problem is going to keep on manifesting itself in different ways. We just call them side effects, right? And so symptoms are a perfect expression of our parts, power, and information. So we're going to go deep and then pull back. When we think about a kid that self-mutilates or that is super aggressive, that's a symptom, right? So if we give a medication to calm the symptom down, does that mean the problem is still there? Yes, right? Because if you don't give them medication for 2 or 3 weeks, what happens? So they come right back, right? So what could possibly be the reason why that symptom is coming out? What do you guys think? I know that's why you're here to learn. I'm just trying to... No. So what if our parts, power, and information, let's say you're giving them organic food, let's say they're, all the other things are healthy, what if their information system isn't working right? What if they're not able to process the outside environment the way they're supposed to? Would that be frustrating for you? And what if you can communicate the way that you wanted to communicate? Would that be frustrating for you? And now let's add that for like 5 years. Kind of crazy, right? And then you add on top of that, what do most kids, especially on the spectrum, crave? What type of foods? Come on. Crackers, mac and cheese, chicken nuggets, pizza, right? What is all of that? Carbs, right? What is carbs? When do we want carbs? When we're stressed, right? Late at night, after you had eating the ice cream in the middle of the night, right? And so carbs fuel stress. Okay? And so if the body is stressed out, it's not interpreting the information right, also craving these foods now is a symptom of what's going on the inside. Does that make sense? And so we're expressing emotionally, we're expressing physically. The dots are kind of connecting a little bit now, right? And so now we're going to understand, we're going to go into a little bit deeper, what the heck is happening to our nervous system and why is our nervous system getting stressed. So this slide here starts with, actually I'm just going to roll all these out. Okay, yeah. Okay, so this box here, this is kind of the pathway that I've seen in my clinic time and time and time again of when we have a perfectly healthy baby to eventually diagnosed with ADHD, autism, OCD, ADD, seizures, and any one of those things, okay? Let's say they have a genetic or environmentally induced predisposition. So how many of you are familiar with like the MTHFR genetic mutation? How many of you don't know? I'm sorry. Okay, so MTHFR is a genetic mutation and it debilitates our body's ability to detox, okay? To the tune of sometimes maybe 10, 15% difference from a normal, healthy genetic system, all the way to 65 to 75% reduction in the ability to detox, okay? So now, let's say you take a kid with no MTHFR genetic mutation, you give them a vaccine, or you give them a pharmaceutical, or you give them unhealthy food, their bodies are able to detox, you don't see anything wrong, right? You give a kid now a vaccine, a pharmaceutical, or unhealthy food, whether it's even an antibiotic, I've had that happen in my practice as well, their body can't detox. That's going to wind the system up, and that's going to be a lot of stress in the body, right? It's kind of like the difference of, let's say I am not sunburned right now, right? Don't do this, but if you came up and like slap my arm, doesn't bug me, right? But now let's say I'm severely sunburned to where I have blisters, and you just do this, I'm going to be screaming, right? So that's the difference. If you have a genetic or environmentally induced predisposition, it means your body is already predisposed to problems, and then you aggravate that area, their bodies are going to be responding to a higher magnitude as if somebody that didn't have that. Does that make sense? A little bit? Okay, kind of. So the same thing with environment. So let's say, I don't know, let's take, are you guys aware of EMFs or like blue light or, those sort of things? Okay, you should, especially if your kids are doing Zoom school right now. So EMFs are electromagnetic fields, right? We're all sensitive to them. We all actually have our own, okay? The higher and higher we crank these frequencies in our internet, the more and more pulsing, the more and more vibration we're sending through really the earth, but we're sending through us as well. Especially you put on a smartwatch, you got a smartphone, and you're in front of a thing, you got a smart panel on your, like that's a lot of beaming and information going everywhere, okay? Why am I talking about this? Because some people are more sensitive to it. And so you and I, we can be in this room with LEDs, all this wireless stuff everywhere, and we're relatively okay. You take somebody that's sensitive, and they're going to walk in, and it's like someone's crushing them to the ground. And the other thing, so you bring these kids into a shopping mall, and they're shopping mall? Why did I say that? Like a grocery store or whatever. And they're like really sensitive to sound, right? Have you guys seen that video? Like that went out? It's like everything from the lights to the the cart to the cashier, everything is at a higher magnitude for them. They're more sensitive to it. Does that make sense? Okay, so that's what I'm trying to describe here. Somebody is more sensitive, and then we poke that sensitive area. What's first going to happen, in my experience as well as to all the research that I showed you guys earlier, is microbiome depletion. So how many of you don't know what the microbiome is? Okay, so your microbiome is your colony of bacteria that's in your tummy. Really everywhere, but specifically going on in your tummy. I said you have bacteria in your tummy. It's okay, bacteria is good. Okay, we need bacteria. They help us break down our food. They help produce neurotransmitters. They help produce vitamins. We don't have vitamin K if we don't have bacteria. Okay, and so if your microbiome is depleted, well, let's first ask how that happens. First of all, 1 in 3 births are being born via cesarean section, okay? Depends on where you're at. That's about the national average, and I'll show you a video later of why I'm passionate about this. But if a kid is being born via C-section, not going through the vaginal canal, they're not going to get introduced to the outside environment's bacteria. They're getting introduced into the world with a relatively sterile digestive system, okay? Because most of the time, labor takes a few hours, right? So the baby's getting introduced to the bacteria as the baby goes down through the birth canal, okay? So if you have no microbiome, and then let's say you're given antibiotics, why might a kid anywhere from 0 to 3 years old get an antibiotic? Ear infections, right? Then 65% of the kids will get one, okay? So if an antibiotic kills bacteria, does it just kill the bacteria up here? Where does it go? Okay? Acetaminophen, when you get your vaccine and you get a fever, what do they recommend? Tylenol. It's acetaminophen, okay? Acetaminophen destroys your body's entire store of glutathione. Do you guys know what glutathione is? It's the master antioxidant. It actually crosses the blood-brain barrier. So do you guys know what antioxidants are? And they scavenge free radicals. So free radicals are things that cause damage. We'll just leave it at that, okay? So you want glutathione going across your blood-brain barrier to prevent brain damage. So we have a kid that was born via C-section, gets an ear infection, so goes on antibiotics, gets a fever after a vaccine, so they go on Tylenol, and then because they can't turn well, or the mom's not producing because she's stressed and back at work within like 2 weeks, not breastfeeding. Why is this important? You have formula, which obviously provides nutrients, right? However, are you going to have the same level of bacteria in formula, processed food, than you are going to have in live? No, right? And a really interesting thing, there's a ton of research going into it, well, maybe not right this second, but more recently, that the breast milk changes every single feed. The mom is actually understanding what's going on through the environment. How? Because the saliva actually gets absorbed, processed, and then the body changes formulation. Why do you think babies are always touching things and putting stuff in their mouth? They're helping mom actually tell, this is what's going on in the environment. These are the antibodies that you need to make for me, okay? So if we don't have breast milk, then the baby is at a greater disadvantage for their microbiome and immune system. That is going to lead to something that we're going to dive into a lot later, something called a hypersympathetic response. Okay, so we talked about your nervous system. It's your major communication and sensory processing system, right? Now, you have 2 basic behaviors within your nervous system. You have your sympathetic, which is your fight or flight, okay? You have your parasympathetic, which is your rest and your reset, okay? So if your immune system and your digestive system and all that stuff is being depleted and destroyed, is your body going to be stressed? Yes. And is it probably going to get kicked into overdrive? Yes, right? And so that's what this means, hypersympathetic response. Ultimately, that is going to lead to something we call leaky gut. How many of you don't know what leaky gut is? Great. Okay. So leaky gut, in short, is when you have the mucosal cells, right? When they bind, they say, okay, you can come in, and a certain amino acid, and it comes back out. When you have all of this stuff going on, it actually cracks the mucosal cells, so that way stuff is leaking. Indigested or undigested proteins are going into the bloodstream. Okay, only amino acids should be going into the bloodstream, not proteins. So when you have foreign proteins in your bloodstream, guess what happens? Autoimmune. Your body's going to start attacking those foreign proteins no matter where they are, right? And then you're going to have an immune hypersensitivity, which leads to things like allergies, right? Because if your immune system is always going, and then you get exposed to dust or you get exposed to something small, your immune system's like, I don't care what that is, we can't handle anything more, send everyone. So you start sneezing, you get that mast cell, you get histamine, you get all that stuff, right? And then finally, that's going to lead to brain inflammation, and you're vulnerable to multiple pathogens, and that's what's going to lead to something we call leaky brain, which is essentially a brain on fire. Any of you recognize that term? Or locked out syndrome, okay? That makes sense to you guys? I know that you're like, holy cow, he's going to go deeper than that. That was like My ears are already flowing. Luckily, I'm recording it, I think. We'll see if it works. And so I'll upload it to YouTube and send you guys a link so that way you guys can watch it over again. So what's next? Okay, we're going to build things back up now. We're going to talk about where does health come from. Okay, as you guys can see a little bit in the background, we have a whole bunch of different ingredients. I think what we're making here is a cake. Okay, so how many of you have never baked anything in your life? Yeah, especially the lockdown, everyone's baked something, right? I even made molasses cookies like a couple weeks ago. So when you are cooking, you need to have all the ingredients, right? So let's say I have all the ingredients here. I mixed the flour, the butter, whatever this stuff is all together, blend it up, put it in the oven for 20 minutes, take it out, and then add the rest of this stuff, blend it up, put it back in the oven for 20 minutes and take it out. Who's going to eat whatever that's supposed to be? Hopefully nobody, right? Unless you guys are just really sympathetic for me and feel bad. So why did it not turn out how it should have? What did I not do? I didn't follow the recipe, right? I didn't go in order. I had all the parts, all the power, but I didn't have the right information, right? So where does health come from? The right source of information. And that comes from a healthy nervous system. This is just an image to show you. From 25 days, we have a primitive brain and neural tube that goes all the way down. The more we develop, obviously, the more complicated the brain gets until we're at 9 months and we got a brain that is processing trillions and is that my next slide? Trillions amount of information at once. Luckily, for you and me, we're not consciously aware of all that information. Could you imagine? Like, oh shoot, I forgot to beat my heart. Like, I forgot to breathe. Oh, I gotta digest this stuff where it's decaying. That's like from 2 weeks ago. Like, could you imagine if we had to be aware of all that? So we're really thankful that we have those two functions in our body, parasympathetic and sympathetic. That's part of your autonomic nervous system, which means that those are programs that are happening without you having to be consciously aware of it. Okay? So that's what you guys read it right off the slide there. So you're parasympathetic and you're sympathetic, okay? One concept that I really, and I think this is the deepest that we'll dive into the autonomic nervous system. We'll come back to it a little bit later. However, when you look at your sympathetic nervous system, these are all nerves coming off the spine. You see how many different areas receive information from the sympathetic nervous system. Meaning that if you had a problem here and this nerve didn't work right here, I'm trying to find a way to do it, it's not working. This one right here, it's still going to get sympathetic information from the other parts of the spine, right? However, remember this is fight or flight. When we look at the parasympathetic nervous system, what happens if I destroy this nerve here? No heart, no lungs, no stomach, no digestive system, and all the little endocrine organs like the adrenals and pancreas and all that stuff in there as well, okay? And so what's going to happen if this nerve doesn't work, the default information these organs are going to receive is stress. Do your lungs function different under stress? Does your stomach function different under stress? Does everything function different? Yeah, you have higher cortisol levels, right? If you have high cortisol levels, that keeps melatonin low. What do you need to sleep? Melatonin, right? So if you're constantly stressed, you're not going to be able to sleep. What about, and this is not necessarily neurodevelopmental related, let's say you have a circulatory issue because your heartbeat is going fast all the time. That's going to lead to high blood pressure. Guess what happens when you have high blood pressure for multiple years? You get cracks in the blood vessels. Guess what's going to fill that? Cholesterol. What do you get diagnosed with next? High cholesterol. So now you're on hypertension medication, you're on cholesterol medication, yet the problem is still stress. Right? So the body's going to find another way to adapt. It's going to tighten up your muscles, right? Almost everybody that I see that's on Lipitor also has really, really tight, spasmy muscles. We work for a couple weeks. I ask them their medications, and they get off it, and then they're like, oh, it's better, okay? And so this is a really, really important concept that we're going to come back to towards the end. I just wanted to make sure that you guys understand this concept because it's the building blocks for everything else that we do. Does this make sense here? Autonomic nervous system. Okay, so when our autonomic nervous system is relaxed, okay, we have a great birth process. Our body's not being, filled with medications or anything like that. We're in a loving home environment. Mom is able to breastfeed. Just picture the perfect world. This is the general developmental milestones that your kid and we ourselves hit. In the beginning, it starts with tactile, vestibular, and proprioception, meaning that we want to know where we are in space. What happens if you you don't drop your baby, obviously, but go real quick? What do? Because they sense that they're moving real fast through space and I need to slow down, right? Proprioception, their brain's ability to know where their body is in space. How many of you remember when your kid first found their hand? And ooh, that is mine, right in the mouth, right? And then they find their foot, and then they're doing things that like we wish we could still bend that way. So that is the very beginning, and then they start to understand smell, right? And then they start to see you, and then they start to hear you, and then they start to taste things and say no when you give them broccoli when before they didn't care, right? And then they're aware that they actually have two sides of the body, so when they're walking, right? So can you see, like, each stage that we go through becomes more and more complex, okay? So the concept that I want you guys to get from this slide here is, let's say, because we get stress entering the body, I don't know, let's say maybe at 1 or 18 months or, something like that, and we developed up to here, or maybe even up to here, but they keep on aging. So they're a neurodevelopmental level of here, however, we're asking them to do these things here. Can you see how that would be frustrating? Okay? And I'm not against like ABA and speech, and I think all those things are really, really good. However, ABA for people that are here becomes conditioning. You get a card, blue fish, but then you try to look at it in a fish tank. It's like, what is that? Like, they can't put things together. And the reason why is they're just getting aware that their body has two sides, let alone what the heck is going on around me, right? How many of you had that experience where, like, how can you not understand, like, the context or the emotions or the social cues, right? And that's mainly because they are just surviving understanding themselves. They haven't got the chance to hit those developmental milestones further on, okay? So the logical situation for me, in my opinion, is we figure out where the body is to the point where the body is neurodeveloped, okay? We remove the stress from the system. What do you think the body is going to do? Do what the bodies do best, which is grow and develop, right? And it's as simple as that. We remove the stress from the system, the body begins to heal itself. One of the big phrases of chiropractic is the body needs no help, it just needs no interference, right? You can feed the body. My wife is pregnant right now. We're starting on a Chick-fil-A diet pretty much exclusively, it seems like. We're going to make a baby off of French fries, high fructose corn syrup, and chicken. Is that crazy? Like hair, eyes, like all of that stuff off of 16 nutrients or something like that, right? And so the body knows what to do, it just needs no interference. And so now what we want to talk about is how the heck do we get interference, okay? A little trivia, is the autistic brain too wired or not wired enough? What do you guys think, too wired? Don't be shy, too wired? Okay, not wired enough. How many think it's a trick question? Yeah, there you go. Okay, so trying to find out how the autistic brain is different can be like studying a spinning coin. One side said circuits are overconnected, the other underconnected. How can somebody do 492 times 370 like that, but then you ask them, are you happy or sad? And it's like, what does that mean? Or, they're not able to, so in one area, you do not need to know how to do that. That's what our smartphones are for nowadays, right? But it's kind of important to make sure that we are able to socially interact together, right? And so is the autistic brain too wired or not wired enough? And the answer is both. And the reason why is this word here, okay? And this is where we start to get super sciencey again. This word is called disafferentation. What it means, it's an imbalance of sensory information to the brain, okay? So sometimes it gets too much, sometimes it doesn't get enough. The body is pulling from past experiences then to fill in the blanks, or the body is overwhelmed when it gets too much and so it acts out, okay? There's a gym next door in case you guys are wondering, yeah. They just like to make their presence known, yeah. And so disafferentation, if you have an imbalance of sensory information, it's going to cause something called neuroplasticity. So the brain is going to learn what's good and what's bad, okay? For example, let's say you're born, like that first kid that we talked about, you're born via C-section, you get pharmaceuticals, you're not able to be breastfed, mom goes back to work at 3 weeks, and you're with the babysitter or with a bunch of other kids. That's stress right away, right? What is the brain going to think the outside world is? Very stressful, right? Which means that every bit of information is going to be filtered through a piece of the brain we call the amygdala. The amygdala is your fear and stress center. The amygdala is in charge of impulsive reactions, impulsive actions, okay? Because when you're under stress, you don't have time to think, right? I bet you if a tiger walked through that door right there, there'd be some of you running so fast you didn't even know you had it in you, right? Did you think I should probably run faster than I ever have in my life, or did it just happen? It just happens, right? That's your amygdala working for you to keep you alive. Now, how many of you have an impulsive kid? It's not good for chronic living, right? It's not good for everyday decision making. We need to logically think about what's going on up here, right? And so you have another part of your brain that develops called the prefrontal cortex. The prefrontal cortex is responsible for rational decision making, proper judgment, and motor control, amongst other things, as well as the cerebellum back in here, okay? And so if we are continually stimulating the amygdala, what's going to happen, this place is called Trailhead, right? Any of you took a hike before? Yeah, I hope. Any of you gone off trail where there wasn't a trail before? Okay, so it's kind of a little bit more difficult, right? If you're walking the Santa Rosa Plateau on the trail, it's pretty easy to see where the trail goes. However, if you go off trail, you kind of blazon your own path, right? So picture, in neuroplasticity, the more you take a pathway, the more ingrained it becomes. The less you use a pathway, the more impossible to bring up it is, right? Which is why I took 3 years of Spanish in high school and I got pretty good at it. I did a mission trip to Peru when I was in chiropractic school and I knew almost none of it. I didn't use it the whole time, right? But the more I use it, the better I am at doing it now, right? And so if your stress path becomes the dominant path and your relaxed parasympathetic grow path is hardly ever used, it's no wonder kids get stuck on the triangle, right? If that's all the body ever knows, the body's going to stay in a state of protect, 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 survive, survive, survive. Give me carbs so I can keep on doing that. Does that make sense? You guys are doing awesome. Okay, so we talk about what's next. First of all, I want to honor it takes a village, meaning that what I'm going to talk about tonight, or the kind of a lot of the rest tonight, is the neuroscience behind what happens when we start messing with the vagus nerve through stress, okay? I'm going to be talking about how chiropractic can be part of the solution, one of your options, a holistic option for you to fix at least that's part of what's going on. You meet one kid with autism, right? Everybody is different. Everybody has very different results. And everybody needs something a little bit different. And so what I want to kind of propose to you is not only can I be a chiropractor that knows what they're doing with the spine to help reduce the stress, reduce the interference, allow the body to grow neurodevelopmentally, but then we can work out a plan together. Let's try this nutritionally. Let's try this via supplement. Let's try this. You know what I mean? So that way you don't have to waste a bunch of money doing a whole bunch of different things wondering if it's going to work, right? And so we can not only be a chiropractor, but we can also be a guide, right? That's why I call it Trailhead as well. Because I can be your guide along this journey to help you guys make educated decisions on, is this going to help? Is this not going to help? Should we do this? Should we not? Do I know everything? No, but I can a lot of times point you in the right direction or point you to somebody that does know, okay? So, first of all, the biggest factor with this healing is time, okay? That's one thing that we have to honor, and it's the hardest thing, you know, because we're around your kids every single day. We want change just like that, right? But the biggest thing is time, okay? In my opinion, the first thing that we should start out with is the nervous system, looking at if there's stress in the nervous system or not. And the reason why is because if you don't have any information, nothing else really is going to work as well, right? Once the nervous system is working well, then we can start checking out the diet. Once the diet's been pretty good, then we can start healing and sealing the gut. Once we have proper digestion and absorbing, we're not malnourished or anything like that, then we start to work on healing the blood-brain barrier, reducing the inflammation and those sort of things. Then we can start getting rid of the bad stuff that shouldn't be in there. Then we can start to create new patterns. We look at primitive reflexes, brain hemispheres, and things like that. And we go round and round we go, right? Because the autism is a whole body deal. It's not just one thing, right? Which is why one people can go no gluten, and it's like, oh my gosh, I have a different kid. And another mom tries it, and it's like, they got worse, and so that's why. It's not that you're doing something wrong. It's just that we need to explore a different pathway. And maybe doing chiropractic first and then going no gluten is the way to go. Maybe detoxing, you know what I mean? It's not. We want to try to understand what is the most important thing, what is the most significant source of stress in this person's body. Attack that, and then go after the lesser ones after that. Okay. So we talked a lot about interference, okay? Another word for it is disconnect. In a perfect world, we have our 5 senses, and we actually have 6, we'll go over it in a minute. Those senses reach the brain interprets them, if not through the amygdala, but through everything else here. If we have a proper brain-body connection, we're gonna have an optimal information processing and response, which means that we're gonna be experiencing optimal health. This is a perfect world, right? However, we understand that the senses don't really change too much, but there's a problem with our output. There's a problem with our function, right? And usually, it's the way the brain and body are connecting via the nervous system, right? Because our body doesn't work on Bluetooth. I'm going to introduce a concept to you called the vertebral subluxation. Have any of you heard this before? Yeah, so the subluxation was when the spine isn't moving the way it's supposed to. Let's see, how do I have it? The vertebral subluxation is a misalignment of the spinal column, which puts the body into, and I'll add, a systemic state of stress, okay? And the reason why, especially when we talk about upper cervical right up in here, which is where I find most kids are the most locked up, is do you remember what nerve started off right at the top of the spine that went to everything on the inside? The vagus nerve, right? So if we have inflammation right up here, vagus nerve isn't going to be working right, the default becomes stress. We start to get movement in the upper cervical spine, parasympathetic nervous system kicks on, inflammation starts to get better, the body does what it's supposed to do, right? That's like the abridged version. We'll go a little bit deeper. So the subluxation, one of its side effects is disafferentation. That's helpful, right? Because if we remove the subluxation, we get balanced information reaching the brain, which means that our body's not going to develop these poor neuroplastic stress pathways. It's actually going to use both of them. Because I'm not saying stress is bad. We want stress in particular situations. We just don't want it on chronically all the time, right? And then another bummer when you have a subluxation, especially in the upper cervical spine, is you have decreased brainstem and or brain blood flow. So what I would like to do the rest of the time is just basically this, just spit out some science and interpret it for you guys. And then we'll... Yeah, and I got a couple other things to show you about the birth process. This is just 2 studies that I've actually been published in. Improvement in childhood autism following chiropractic care, and then the second one, resolution of severe reflux, chronic constipation, sleep disturbance, and developmental delays. And I actually have his scans that we'll go over in a minute as well. So just some cool stuff. This is their testimonial there. This kid... colic, constipation, acid reflux, torticolic, developmental delays, sensory processing disorder, sleep issues. Like, could you imagine this kid was 8 months old? Okay, and so I'll tell you what happened. Is his slide next? No. I'll tell you what happened is he had a very big head. Mom tried to birth vaginally, got stuck. Did 4 vacuums to try to, not at the same time, but like 4 different attempts to pull the baby out, decided it's not coming out this way, so then did a C-section, had to pull the baby back out the other way, and was born with severe torticollis, which means that they can't turn their head, okay? And so with torticollis, do you think there's a little bit of stress in the vagus nerve? Yeah, right? And so that's when the baby developed acid reflux. Wasn't digesting the food the way it's supposed to. And then because they're malnourished and weren't absorbing as much fluids and whatnot, we start to get constipated. And then because we're not malnourished and we're stressed, we're not going to hit those neurodevelopmental milestones. So at 8 months, 9 months, not even crawling, not even showing signs of crawling, not even rolling over, okay? To the point of the colic, crying 19, 20 hours a day, where the neurologist actually wanted to put him on an antidepressant or an anti-anxiety, some sort of psychotropic medication to just do something to calm this down. They're at the point they'd been going to PT twice a week, since 2 weeks, to the point where they met me, okay? She's my patient, so she's fine. Otherwise, so twice a week until they met me at 8 months old. Had very little change at all, okay? To the point where what they were going to do is actually cut this muscle, stretch it, and then reattach it. Like, that's where they were with this baby. The mom came to a seminar like you, said, what the heck do I have to lose? Like, I'm not putting my kid on one more medication, right? We started getting them adjusted, and then those are the changes that they started to see. The body first detoxed. I'm talking toxic poops. There's probably still some hazmat sign wherever that diaper is now. I guarantee you it's not decomposed yet. They were able to stop the Miralax. They're able to stop the Zantac, which is shown to have carcinogens. I don't know if you guys saw that silent little study that came out like not too long ago. But anyways, they started the Zantac with the acid reflux. Baby started rolling over. Baby started crawling backwards. Like, so many things in the first, 3 weeks or so. But the best thing is the baby started turning their head. Didn't have to go to PT anymore. And it's crazy because nobody told this mom, you had a very stressful birth. This kid's neck has been yanked 4 times one way and probably a couple times the other way. Maybe you should get checked by somebody that knows what they're looking for or looking for problems in the neck, right? And that's what bugs me the most. I'm not on this pedestal saying like chiropractic can save the world. I believe it can. But what I'm saying is that we should be at least introduced as an option. Like, hey, check this out. There's some neurological, there's some really good research that shows when your spine isn't moving right, your body won't be working the way it's supposed to. In fact, you're going to be very, very stressed if it's not moving right, okay? Big tangent. Anyways, well, I'll go to his scans in a minute. So this is some research that shows how the brain and body process when you're adjusted versus not adjusted. Cervical spine manipulation, we don't use that term here, but that's the scientific way to say the adjustment. Alters sensory motor, so the way your body is processing and translating information. What they found is spinal dysfunction, so poor movement in the spine, alters sensory, which is afferent input to the central nervous system. Another word for that is it caused disafferentation. We got adjusted. So altered afferent input leads to the central nervous system, leads to plastic changes, so they're on a stress pathway. Neuroplastic changes take place both following increased and decreased afferent input. So what they showed is that we did an adjustment, and it changed the way the brain and body process together, which means that under a subluxated state, your brain and body don't process well, right? This next one, vertebral subluxations create neuroplastic changes and functional neurophysiological changes to the central nervous system due to altered afferent input. Okay, so basically another study saying the same thing. And these guys are Kiwis from New Zealand, so you can trust them, right? They're awesome. And these guys are actually really, really smart. Both, actually, I think all three are chiropractors. And then I'm pretty sure all three are also PhD neuroscientists. Like, it's incredible. So when we're talking about sensory integration, and I talked about that we have that sixth sense, okay, this is where we're going to get into that there, where we have our touch, taste, feel, smell, sound? Yeah, I think that one, right? Okay, so that information somehow goes to the brain. It's going to enter the brainstem because that's where the amygdala is. When the amygdala says, and this isn't stressful, it's going to send it up to the thalamus, which reroutes it to the cerebellum, and then it processes through the whole rest of the brain. You don't have to know that, I promise you, okay? However, you have one sense that is actually almost more important to the brain than any single one of those, called proprioception. Okay, and I've mentioned it before. It's your brain's ability to know where the body is in space. Does that concept make sense to you guys? Okay, so what I want you to do is close your eyes. You're going to put your hand out in front of you, above you, to the side. Don't hit your neighbor unless you don't like them. Okay, good. Open your eyes. You can put your arm down. How did you know where your body was, or where your arm was? You just knew. Right, so that's proprioception, your brain's ability to know where your body is in space, okay? So this Dr. Jeremy, PhD, found that movement of the spine simulates the cerebellum, which is responsible for coordinating full body movement, thoughts, feelings, emotions, and the healthy functioning of the organs and immune system. So if you have poor movement of the spine, what does that sound like? A vertebral subluxation, right? Your cerebellum isn't going to be stimulated. How many of these kids with autism, ADHD are not very coordinated? Some of them are way coordinated. I find the majority of them are not that coordinated. A lot of them have, let's see if I can do like the walking where you're kind of like, you know, rather than the cross crawl. Does that make sense? I look like Sasquatch. But when you're all on one side like this, that means your brains aren't communicating. You're functioning on, your one side of the brain is doing one thing, the other side of the brain is doing the other thing. So if you have poor proprioceptive input reaching the brain, that's going to trigger the amygdala. Because if your brain doesn't know where your body is in space, is that a big deal? Yeah. Kinda, right? How many of you woke up at night and your arm is numb and you're like, yep, this is not good, right? I hope this comes back, right? So that's how your whole entire body feels when your brain doesn't get information from your spine. You want to know something else? 60% of all the proprioceptive receptors, so you have them everywhere, are located within your spine. Guess where the largest majority of proprioceptors in your spine is actually found? Surprise, surprise, right? Because it's kind of a big deal if your brain doesn't know where your head is. Right? And so if you have a problem up in your upper cervical spine, what is it affecting now? We talked about the vagus nerve, right? Now it's affecting the dominant source of afferent or sensory information reaching the brain. So is a subluxation in the upper cervical spine kind of a big deal? So when you get it moving, not only are you giving the brain more information, you're giving it information it didn't have before, and you're introducing, I think that's the next one, a calming sensation into the body. What do kids with autism need? Kind of like all three of those things, right? When do a lot of your kids like big squeezes, like hugs, or that's why like weighted blankets and all that stuff. Why? Because that's that stimulation of the proprioceptive system. Or these kids that like to like touch themselves and stimulate themselves that way. Why? There's a lot of receptors in those areas, and by stimulating them, it gives the brain information about a little bit about what's going on in the area. And even self-mutilation. When you bang your head against the wall, when you punch yourself or whatever, you're giving your brain information about what's going on the outside. So when you get the body adjusted, does the body need to search for information in that way anymore? No, right? So that's why chiropractic doesn't cure autism. Chiropractic doesn't cure self-mutilation or stimulation or any of those things. We get to the root cause, allow your body to process the world the way it's supposed to, and when you don't have a need for more stimulation, you don't do it. Right? It's also why sometimes, I'm not promising this one, diets change when kids go when kids are starting to get adjusted, because you're not trying to fuel the system that's go, 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 go anymore, right? You actually get a chance to calm down. It's like, wow, like I have the enzymes to digest a piece of lettuce. Because it's kind of hard on your body to digest lettuce, right? And so, or drink a smoothie, or I can try different textures, because the reason why they don't like other textures is because they know that one isn't going to hurt them. So if you're able to like, okay, let's try it, we can take a little bit, oh, it's fine. And now we can eat more and more and more, right? So this just basically talks about neck adjustments had a parasympathetic effect on the body, which is awesome. And then perhaps either this one or one of the next ones, my favorite study, cerebral metabolic changes in men after chiropractic spinal manipulation for neck pain, okay? So what they did is they did a functional MRI and measured glucose metabolism. In English, when you are using a lot of sugar, your body is stressed. When you're using a less amount of sugar, that means your body is less stressed, okay? So they did a functional MRI, measured cerebral glucose metabolism levels, did an adjustment, did another functional MRI, and guess what they found? The results of the study suggest that chiropractic spinal manipulation affects regional cerebral glucose metabolism related to sympathetic relaxation and pain reduction. And they found that in the brain. Guess where, and I don't think they've actually released this study yet, guess what area of the brain gets activated when you stimulate the body, or when you adjust the spine? It's the only other part of the brain that we talked about, amygdala and prefrontal cortex. So you take a kid with autism, their amygdala is on, which means that they're impulsive, which means that they're feeding this neuroplastic change of stress, 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 which is why they eat poor food, continue to get more malnourished, become more and more impulsive, right? And then enter chiropractic, where we allow the vagus nerve to work, we allow the brain to now calm down, right? And we're activating the prefrontal cortex, the antithesis or the opposite of the amygdala. It's no wonder why we start to see changes. Does that make sense? Awesome. And that's also why I really love OT and PT and movement for these kids. It's why I am pretty much against what you guys are doing all right now, is like sitting down, not doing any movement, right? We're doing it for a certain amount of time, not 7 or 8 hours, right? It's why I love giving these kids like exercise balls to sit on. And there's other countries like Sweden that have been doing it for a long, long time, giving kids little pedal bikes underneath their desk. So getting movement stimulates the spine, which stimulates the brain, and specifically the area in the brain that's designed for learning. Makes sense, right? But it's too expensive. Okay, so subluxation and autonomic balance. So we're getting into the part where, okay, Dr. Chris, you've talked about autism, you've talked about health, you've talked about what causes stress, and we know now that stress leads to poor health. Now, how do we measure in my body if I have stress, right? And so one of the things that we use is called infrared thermography. The reason why we use this is because skin temperature is regulated by the autonomic nervous system. Is any of you thinking about like the specific skin temperature of any part in your body? Hopefully not, right? So either side of your spine should be relatively the same temperature. So if we measure that, we can see if both sides are relatively the same temperature, then your autonomic nervous system is doing its job in those particular areas. If we have a big difference, one side is way hotter and one side is way colder, then we know the autonomic nervous system is dysfunctional in that area. Why is that important to us? Because if you look at the spine, you have nerves that are going out from each and every area, and guess where most of the time I find a ton of inflammation? Right up in there, right? So now we have objective proof that something is going on up in the upper cervical spine. We do a series of adjustments. It's different for everybody. We do a rescan, and guess what we start to see? Less and less inflammation. So we're not dependent on symptoms to know whether the problem is gone. We actually have real science and tools that we can use to measure it. And this is, so this is that little boy that I was talking about earlier that had the 4 vacuums and then was pulled out the other way. This is his very first thermal scan. White is good, blue is moderate stress, red is severe stress or severe inflammation. Okay, I have never seen, till this day still, a baby with that much inflammation going on at 8 months old. Okay, so this is a week later, and then this is, so the end of December, and then this is February, and then this is July. Isn't that crazy? No wonder we started to see the changes that we saw. Why? Because the body was very stressed, we took the stress away, and the body started to do what it was created to do, right? So, last piece of the puzzle, and we are doing amazing on time. You guys doing okay? I know I'm like blasting you guys. I can see It's like a sandblaster, like the skin cells starting to peel back. So what causes the vertebral subluxation? Overall, stress, okay? Now, you have three main sources of stress. You have physical stress, you have chemical stress, and you have mental stress. What we're going to focus a lot of our time on is this physical stress, okay? I have a talk, I just did it last month, called the gut-brain connection, that we go pretty deep into the chemical stress. So if that's something that interests you, either you can sign up when I do that again, or it's recorded in the Facebook group. I don't know, do you guys get an invite to the Facebook group in your email or anything like that? Okay, so maybe in the follow-up emails, you'll get an invite to the Facebook. If not, just text us or email us, let us know. And you can watch that one. But we're going to focus a large majority on physical stress, okay? So back to the birth process. 1,000 infants were checked in the first month of life. 80% were found to have a vertebral misalignment of the upper neck. How many of you think this is groundbreaking research, like 2020 status? You guys in the front, read this date for me, or year? 1987. We've known for how many years is that? 30 years? That 80% of every single birth, these kids have a vertebral misalignment. And our OBs and our pediatricians aren't saying, hey, do you have a pediatric chiropractor on your team? Or a cranial sacotherapist, or a DO? Somebody that actually will look at the spine and determine if there is an issue with the spine. No, right? 1,250 infants were evaluated during the first 5 days of life. It was found that 90% had suffered birth trauma and strain through the neck and cranial areas, with 10% suffering severe trauma. 1966. Crazy, right? Not okay. Not okay with me. Hopefully not okay with you guys. And so with this, do I have one more? With this information now, anybody that you know is pregnant, what are you going to be telling them to do? You should probably go get adjusted while pregnant because your stuff is going all over the place. Second, when your baby is born, you should probably what? Get them checked either here or if there's somewhere else we can find them, get them to a pediatric chiropractor. Why? Because it's going to give them the best shot to live a life with the least amount of stress to experience the most amount of life. That salutogenic approach. Instead of trying to focus on take away disease, we're going to give them the best shot to experience the most amount of life from day one. And then KISS syndrome, these delicate upper cervical structures undergo considerable stress during delivery. This is said by an MD. Primary risk factors for developing KISS syndrome. What did that actually stand for? Kinetic, I don't know, that's your word. Kinetic, it's something to the effect of the upper cervical structures aren't moving the way they're supposed to. Okay, it's not keep it simple, stupid, I already checked. Most of the afferent proprioceptive signals originate from the cranial cervical junction. Any obstacle impeding these sensory signals will have many more extensive consequences in developing nervous system. So key factors that are going to lead to something called KISS syndrome: long labor, C-sections, extraction with the vacuum, twins or triplets, prenatal position anomalies such as breech, transverse, sunny side up, and things like that. So especially if you know anybody experiencing any of one of these things, they should probably get to a chiropractor as soon as possible so that they have their kid has the best chance to have the most life possible, right? And then the really cool thing about chiropractic care is we don't have something called side effects. We have something called side benefits, okay? Meaning, I came in because my neck hurt, I left without a headache. I came in because my neck hurt and I slept better last night. I came in because my neck hurt and I lost 10 pounds over the weekend. I came in with this. All these things start to happen. Why? Because we take away the stress and the body does what it's supposed to do, right? I think I have a picture at the end of me and my sister. The reason why I'm a chiropractor today is because my sister was one of those ones that had the reoccurring ear infections over and over and over and over again. What did we do? Antibiotics over and over and over again. She started to develop asthma. She was a soccer player. Not a good combination. Then she started to develop allergies. Again, not a good combination for someone that loves running on grass, right? We had to stop going to the beach. We had to stop going to the pool because she kept on getting these ear infections. One day we're sitting in the pediatrician's office, me and my sister and my mom, back when you can have like more than 2 people in a doctor's office, right? And somebody looked over and like, hey, I noticed like you're here for an ear infection. Have you ever taken your kid to see a chiropractor? And my mom's like, no. Like, you know, that was never an option given to me. And so she's like, well, where do you go? We went. His name is Dr. Breitenmoser. He's a Polish dude. I don't think he practices out here anymore. He was like one of the first chiropractors like in Marietta, which is really cool. Guess what happened? Ear infections went away. Surprise. Why? And I'll go into a little bit of it because I know a lot of kids struggle with ear infections. You have a little muscle that surrounds the eustachian tube, which is the drainage tube, right? If you stress up here, these nerves are going to go to the muscle, and the muscle is going to contract, which does this, What happens to the fluid in the ear if the tube is shut? Stays in there. When you have warm, nutritious fluid, what's going to be attracted to there? When you have enough bacteria, what's going to happen? Immune system's going to come, and that's what causes inflammation, right? So you do an antibiotic, we already talked about this, it goes here and also here, so the bacteria is gone, but you have warm, nutritious fluid, guess what's going to come back? Bacteria, right? We start to get better movement in the neck, the muscle starts to relax, what starts to happen? Natural drainage. What I've seen happen over and over again is you do ear infections enough times, what surgery do you get in the ear? Right? And so that changes the pressure, so you have an enormous amount of drainage, which starts to infect what? And so you start to get tonsillitis over and over again. And what do you get? Tonsils taken out, another immune system barrier being taken out, right? That drives the infection deeper into your lungs. What do you start to develop? Asthma, allergies, right? And so now you're on albuterol, now you're on this, and now you're Claritin, now you're on all these different sort of things, right? To calm the immune system down, now what happens to your gut? It's inflamed. Why? Because 60 to 75% of your immune cells are located where? So if your gut's messed up, so is your immune system. If your immune system's messed up, so is your gut. So then you start to get constipated. You go on Miralax. And then you start to have neurodevelopmental issues, right? And so then you go on Adderall, or then you go on Metformin, or then you go on all these different sort of things. All started from the fact that the pediatrician didn't say, hey, you've had like 3 or 4 ear infections. What we're doing isn't working. Maybe you should go see somebody that has a different approach, right? I'm not mad at pediatricians at all. I think they do a great job doing what I don't like to do, which is diagnose and treat disease. But if you're looking for some way to bring health into the body, you don't take away disease, you bring life into the body, which means you remove interference, give the body the chance to process the environment as it's supposed to. Does that make sense? Cool. Just a couple more testimonials here. We do infrared thermography scan. Sometimes we don't pick anything up, which is why we do a second scan called surface EMG. Surface EMG is measuring muscle tone. When you're stressed, are your muscles going to be tighter or looser? Tighter, right? And so, once again, white bars is healthy, green is mild spasming, blue is moderate, red would be severe, okay? So this is a surface EMG scan of a kid whose muscles are like, tight, going all over the place. We start to get them adjusted, and guess what happens? Muscles relax. Symptoms that follow, able to sleep better, no more headaches, able to eat different sorts of food, able to interact with the environment, with his teacher, with his friends. And then this is another one here. I like to give this example. This is the stress right up top. Got better still a little bit. Sometimes these kids are so fidgety. I'm sure some of you are thinking right now, I think this kid was like maybe 3.5 or 4. That we only get 2 measurements in the spine because they just have to sit and we just touch the spine. And you guys are like, yeah, there's no way you're going to do that. So we got 2 areas and we called ourselves lucky. After a course of treatment, guess what we did? Yeah, we got the whole spine and it looked really, really good, right? So finally, what does a session look like? I think this should be a video here. So this is me adjusting a couple of babies. I do actually want to turn the sound on for when that's coming up here. Does that seem stressful at all? No, right? And now let me counter that with how some of these kids are being brought into our world. If you have a squeamish tummy, then you might come over. Hey, what's going on? Connected, waiting for signal. I'm giving you signal.
Did you forget the definition for KISS?
No, it's okay. There you go. All right. So this is just like the last 15 seconds of what it looks like for a baby to be born via C-section, okay? So that white thing is a vacuum. Crazy, right? Yet what we do is put all over the news like we're cracking babies' backs and destroying them, but that is common practice. Not okay, right? And then a typical new patient process, we go over everything together. I explain the spine. We'll be doing the scans. That's going to show in a second here. I think. Yeah, there it is. So that's the thermal scan, that's the surface EMG scan. So super easy, not invasive or anything like that, at all. Sometimes we do get kids that are super scared of going to doctor's offices, rightfully so. So if you're thinking there's no way like you're going to get my kid to do anything remotely of what you just showed me or talked about, it's okay. Like normally this office is not set up like this. We have it very open. The kids can run around. They can do what they want. Go lift weights for all I care. No, but we want to make sure that this is like a warm, healthy, peaceful, healing environment, for them. I've had kids where they come in, they just play, get a sticker, we say good job, and they go home. And then eventually when they get warmed up, then we can start doing more and more and more, okay? So our goal is to work with you and with your kids, not impose our will and them have a terrible experience with chiropractic and them never wanting to go back for you or the kids, okay? So we try to be as open and as understanding, as possible for you and for your kids. And it's also a reason why I have a big open office as well. Normally, as you can kind of see in the back there, we don't do closed room adjusting, means we're not going to a room and closing it behind them. They're still in the open space. There's a fishy table that we have right out in the open as well that a lot of kids, like to use. So again, we try to make things as like non-aggressive, like I'm coming here to do something to you rather than I'm here to help you, I think this is the last testimonial for the night. So this is my baby. Okay, this is Rosie. We were planning a home birth. Long story short, my wife's water broke right at 40 weeks with her first one. No labor or anything like that, just kind of like spontaneous, rupture. She labored at home for 36 hours and nothing really was working. We ended up going to the hospital to get the Pitocin. Trust me, walking into the hospital with 3 midwives is not advised. You're not treated very well at all. We had to go on Pitocin. About 46 hours, Rosie started to come out. The OB was monitoring the heart rate monitor and it was going down and it wasn't rebounding the way that she liked. So she turns to me, a male, first baby, right? She's like, hey, can we do a episiotomy? We need to get this baby out. I'm like, first of all, what male is going to know what the heck an episiotomy is with their first kid, like let alone like, you know what I mean? But because I work in this field, I know, and I'm like, we got this, no thank you, we can do. And I looked at my wife and I'm like, hey, we gotta go. Like they're rushing in the neonatal unit, like now is the time if we wanna maintain, control of this, right? So Rosie's head starts to come out. I'm focused on my wife. OB, I see the head come out. OB starts to put her hands around Rosie's neck and starts to pull. And I am like 48 hours, like no sleep, like, you know what I mean? In the hospital where I don't like to be with my wife, hooked up to a bunch of, like, my stress levels are like here, if not here, right? So I literally yell at the OB, like, what are you doing? Like, stop pulling on my, and she eventually comes out. She comes out thrashing and crying, and I've been a dad for like 2 minutes. I know something is not right. Like this isn't normal, newborn stuff. Lays on my wife for a couple of minutes. They take the baby to the little tub or whatever to weigh them. She literally almost thrashes her way like out of the tub. Like she's an 8-pound baby, so pretty big, but not like where she should be coming out of that, I wait a half hour until, it took a half hour for all the doctors and whatnot, to leave. And I go over there. She had her eyes closed this whole time. She was crying the whole time, very, very tense the whole time. I put my hands on her on the left side of her atlas. I'll never forget this feeling. And I just do my adjustment, just a tiny little movement, and this is what happens. It's like, whew, like life is back, And I cannot imagine this little spunky little girl that she's 4.5 now, she'll be 5 in May, what her life would be like if I wasn't able to be there, right? Granted, maybe would an adjustment made a difference maybe, 10 hours versus 5 minutes or 30 minutes? As early as we can, you know what I mean? And I continue to adjust her every day or so until I saw the stress was completely gone. That her body was able to understand, like, look, I know the beginning was stressful, but entire life isn't like this. Right? I was able to help her body correct that afferentation, disafferentation, remove that stress signal, pave that way for that new parasympathetic relax signal, and everything else has been really, really good neurodevelopment from there. So this is not only something that I practice for other people, this is something that I preach. My second one we ended up having at home, and I adjusted her like 5 minutes after, which was awesome. And so, yeah, and I'll be doing the same, with our third as well. I tell you, I've adjusted a lot of newborns, but there's nothing like putting your hands on your own kid, where it's like, this is up to me, it's really cool. So what I want to leave you guys with tonight is basically just an opportunity. I know you learned a lot. I know you feel empowered. I know you probably still have a lot of questions. What I want, normally my intake process is $195, okay? Tonight I'm offering it to you at $97, and mainly because you guys are now qualified people who understand, that are here, like, let's get it done, let's not waste any more time. What you get for $97 is we're going to do a phone history and consultation together. I find this works really, really well for our kids with autism, so that way you're not like trying to talk to me and lasso them and talk to me and lasso them. We'll do a posture analysis if they're able to stand still. We'll do all of these as much as they can. We'll get as much data as we can. We'll also feel their spine. Fancy that. We'll actually lay hands on your kid and feel what's going on. We will also explain everything to you. I'm going to hand you a copy of their scan so that way this is what's wrong. Can I help you? If I can help you, here's what our plan is. So you get this is a personalized recommendations where I need to see your kid or you this many visits over this period of time. This is how much it's going to cost. Let's go. Here's everything there. If you do want to get adjusted or your kid want to get adjusted on that first visit, that's not included in this. That's $48 is our adjustment. And that's per adjustment, future from there. Most common questions, we don't accept insurance, mainly because I've tried to bill insurance, chiropractic and autism, and they say, no way, Jose. This doesn't work. I was getting hosed or I was getting refunded or paid back $15 per adjustment. And I'm like, no. I really want to make sure that the people that I'm working with are in it and they're not just going to use their 12 visits their insurance gives them and then bail, because a lot of times it takes a lot more time and visits than that. I'll give you guys kind of the range just so you guys know. We recommend anywhere usually from 28 visits to 52 visits is the most extreme, anywhere from 4 months to about 6 or 7 months, okay? We do offer monthly payment plans or prepaid plans that give you a little bit of a discount, about 10% discount. Those plans range anywhere from, I think we're about $250 on the lowest one all the way up to about $350 on the highest one. So I want to let you guys know that. So if you are considering this, I want you to take advantage of this discount here, but that's somewhere along those lines, that you would be looking at. And then we do have family plans as well. So let's say you want to just come in once